So can you get pregnant with PCOS?
Yes, you can. And so it may make it more difficult if you are skipping periods, if you are not ovulating regularly. But there are a lot of people with PCOS who have perfect periods. They're ovulating every single month. So this is where we come into the every woman is different. So it is something that can be a very common cause of fertility problems because if you're not releasing an egg, you can't get pregnant that month.
I wanted to emphasize that first part of the answer that you said, yes, you can, because many times what people may read or see, they come into the office with the notion, if I have PCOS or if that's the diagnosis or if I've been diagnosed with it before, now I can't get pregnant. And so most of the time that I spend with patients is reassuring them that that does not mean that they can't get pregnant. And so I see a lot of tears. I see a lot of relief, sighs of relief when I explain that to patients because that really is the fear that they came in with, is that because I may have PCOS, then I can't get pregnant. Now, if someone does have PCOS and does get pregnant, can it impact their baby's health?
So it does increase your risk of things like insulin resistance and diabetes, which in pregnancy can mean an increased risk of gestational diabetes, where you have higher blood sugar in pregnancy. And that can definitely impact, the health of the growth of the baby. People can have a slightly increased risk of things like birth defects if it occurs early in pregnancy. And then later, closer time of delivery, it can increase the risk of things like C-sections.
Yeah. And that's a lot of what we saw when we were delivering babies at the time, is if someone has that diagnosis of gestational diabetes, that we really have to watch those patients and the growth of the baby and also for the delivery to make sure that there was a safe delivery. So it definitely does impact both mom's health and baby's health.
So important because patients are sometimes they're told or they kind of hear this message that you are infertile, like you cannot get pregnant. That's usually not true. And also this becomes important. People may have heard of the term Ozempic babies or where, you may have had difficulty with ovulation and trouble getting pregnant. Sometimes with those weight loss, with things like GLP-1s, they actually start to ovulate regularly without realizing it. They may get pregnant without intending to. So it is very important that people don't get that message like you cannot get pregnant, both in terms of, not discouraging people, but also not giving them a false sense of, oh, well, I don't have to worry about birth control because I've been told I'm infertile, because oftentimes that's not the case.
Stay tuned for more discussions with leaders in women's health. Remember to subscribe to our channel and follow us wherever you get your podcast. And with that, I want you to stay well, and I'll see you soon.